my name is Joanna Sheely, and this is Whitney Whitehill, and we are presenting an analysis on COVID-19 spread at Southwestern University.
So before we start, I want to do a little privacy disclosure. So the data we are using was provided to us by the Southwestern Health Department. We weren't given any names or anything too revealing, but in order to further preserve the identities of the people who did test positive for COVID or quarantined, we will be withholding certain information. This definitely is an intent to cover or hide anything up. This is really just out of respect of privacy. And additionally, the data we did use will not be shared pretty much under any circumstances unless it's released by the school.
So our goals in our research were to understand the spread of COVID-19 on campus during the fall of 2020. We wanted to organize and statistically analyze the data, visualize the spread using Python and network graphs, as well as create an easily accessible program that can be used to analyze future COVID-19 cases. And along with our privacy disclosure, I wanted to mention that we were given a very small data set, which is a good thing, which means we didn't have a lot of cases, but some assumptions must be made, and we tried to make as few assumptions as possible, but that's the case. And then Southwestern University's COVID-19 protocols start off, obviously, with a positive case being identified. And then the health center notifies the case and asks them to sign a notification consent form that allows the university to notify care coordinators, to report the case to Williamson County, as well as notify any other entities on campus, such as athletics. Once the care coordinator is assigned to a case, they reach out to the student about isolation, fill any prescriptions for them. They start conducting a contact tracing investigation where they reach out to any close contacts of the positive case and let them know about their quarantine. They also inform the faculty of isolated and quarantined students, as well as maintain a spreadsheet of information on the cases, which is what we were so lucky to be able to use. Once the close contacts are notified, they must quarantine for 2 weeks after their date of exposure, and the positive cases must isolate for 10 days after the onset of symptoms or 10 days after positive test results. On these graphs, we can see the outbreak of the cases by date through the different months. In August, we only had one positive case, so I didn't include that one. September, you can see there's some peaks where students were coming back to school. And in November, we have a lot of cases outbreak, but this does directly correlate to peaks in Williamson County cases, as well as November being a colder month. Could be that the virus just spreads more easily in the colder weather. Here we can see some statistics specifically on our positive cases. And this just kind of shows us that most of our cases were tested off campus or through patch testing, which is our on-campus testing for those that are already experiencing symptoms. So most students were proactive when experiencing symptoms to go out and get tested, as well as the two pie charts on the right kind of show us that most of our on-campus students that were identified went home for their isolation, and most of our off-campus students just stayed off campus. Here we can see a more direct correlation between the Williamson County cases and our cases on campus. In our big table here, we've got our random tests by week, the positive tests from those random tests, and then our positivity rate compared with the Williamson County positivity rate. We can see that they had about 3 to 8% positivity, while we stayed well below 2%, which is pretty awesome for us. And we can see the relationship on the left between positive cases and who they infected or how they were infected. So most of our positive cases we're not sure of because they were infected somewhere off campus. However, for those that were quarantining because of a case on campus, we have a better idea of how they were infected. And we can see that that's pretty evenly divided between on campus, off campus, sports teams, Greek life, stuff like that. And then here we have our infection rates and the quarantine lengths. So as I mentioned before, positive cases are only required to quarantine for 10 days, which is why on the right, or I mean on the left, our graphs are more centered towards 8 or 9 days for those positive cases. And then we've got a big spike at 15 for our quarantined cases, which is that 2-week rule. And then on the right here, we've got how many people a positive case on campus might have infected, or how many people were quarantined because of that case. And the good news is that most of them were at 0, so nobody was infected, nobody quarantined, although we do have a few outliers closer to 20, which is going to be our sports teams and Greek life and stuff like that.
So we created additional visualizations using network graphs, and 2 important definitions to keep in mind is undirected graphs, and these are graphs where the lines and the edges are bidirectional, so there's no arrow indicating how the spread was made. And then a disconnected graph, which means that every node or vertex does not necessarily have a line connecting them. And so as you can see here, here are 2 graphs. And so to the left, this is by date. And so this is November when we had our main spike, and each line will indicate a day. This was used using a website or a computer visualization. And so you can see the spread throughout the month and the different days, but you can also see that they're not necessarily entirely connected. And additionally, if you look to the right, you kind of see the same trends, but this is every case that was reported in the fall at Southwestern. And so you see these clusters of, a lot of people being quarantined. However, that's like, mainly you see here that people are really just sticking to their roommates or their own friend group. They're not necessarily going and spreading throughout campus, which I think is a really positive thing, that there's not a whole lot of connections in the spread. So the assumptions why these are bidirectional graphs is that, or the edges are bidirectional, is that we can't say for sure that these cases were spread from each other. However, I think that's a strong assumption that we can make for sure. And so the technologies that were used were Python and Google Colab. And Python was the language we used, and Google Colab's a lot like Jupyter Notebook, if anybody's familiar with that. It's just a way to run Python in your browser and easily share it with people who might be needing to access the code. And so the Python packages that were used, or libraries, are pandas, and this was used for most of the stats analysis. It was also used for reading the data in the Excel files that were shared with us. Network X, this was used to help create those graphs that you saw. And then matplotlibplot was used to create, actually put the pictures on the screen. And so here I have a demonstration of some of the visualization code that I've created. As you can see, you just download the Excel file and then you drag and drop it into Google Colab. And then you run each cell here. And so I have a bunch of different functions that do different things, and I put all the data into a library. And as you can see, the visualization gets projected onto the screen. And so as you can see here, this is a graph from some fake data, but it's a little more meaningful because you have labels on the nodes, so you can actually see who is connected and who spread where. But I omitted that on the big graph just to help protect the privacy those individuals. And so a brief overview of my code, obviously assumptions had to be made about the data and how, COVID was being spread. This isn't super meaningful on a larger scale, just because we didn't have a lot of data to work with, which was great. It's a good thing, but there are other models that would probably be better if you wanted to look at like Williamson County as a whole. And then additionally, I try to make my code as reusable as possible so that it could, hopefully be used in other semesters and throughout the summer.
And future research that we would like to look into, and we are going to continue to look into through the rest of the semester, is we would love to improve our visualization code, the documentation, dates, and error handling, just getting more data from spring 21 and possibly fall 21 would be incredibly helpful, especially if most people are vaccinated in the fall. We could see what role vaccines actually play in preventing the spread on campus. And we would just love to have more data to look at, really.
Absolutely. And so a brief summary and conclusion is that Southwestern realistically had pretty low numbers compared to other counties, but it's hard to make that conclusion for sure because we also are a super small population. Wearing masks and social distancing definitely worked. And even like the random testing, even though we didn't have a high positivity rate, if that person didn't know they had COVID or were asymptomatic, they could definitely spread that throughout campus and that could have caused more tests. So I definitely think it was worth it. And then also the Southwestern students were super vigilant to get tested when they did have symptoms and they did, thought that they had COVID to help prevent that spread further. Here's some resources. And we'd also like to give a special thanks to, Dr. F, Jennifer Spiller, Debbie Polly, Zan Kuntz, Natasha Williams, Dave Sealer, John Ross, and Ed Hillis. Without them, this research definitely would have been made possible. And I think what we did was super meaningful and important for the Southwestern community. Yeah, that is it. If anyone has any questions.
I wanted to mention in doing the research with Whitney and Joanna how independent they were. I mean, I don't know Python, I don't know how to code these things, but they went out and learned that material on their own. They took data camp classes, and so I think it's important, to acknowledge, how independent they were in doing all of this. Great job.
Thank you.
Thank
a lot
you.
of my graphs were also created through Python, which I know next to nothing about, and Whitney was very helpful in teaching me how to use that code and stuff.
I had a question about, how confident was the data for how individuals became infected? Like, how did you actually obtain this data for where they became infected?
A lot of that data was gathered by the care coordinators in their investigation, in their contact tracing investigations. Obviously on those pie charts, we did have some big sections that we're unsure about. But for the most part, the care coordinators did a good job of just putting in their data, like these two people were hanging out together and that's how this person was infected.
Yeah, and a lot of the time it was roommates as well, or people who, suite mates. So, I'm pretty confident about it. Obviously, there's like no such thing as a perfect data set. And if you go to HEB and get COVID and you like bring it back, like we can't track that person from HEB simply because we don't have access to that information. But as far as like it directly on campus, I think I feel pretty confident about what we have with what we were given at least.
Mhm.
So Whitney and Joanna, it looks like there was a question in the chat from Dr. Ross, wondering if there were any other communities you wanted to compare the SU data to.
We did briefly compare
Mhm.
the positivity rates of Williamson County to Travis County,
Mhm.
just to kind of see, I mean, because Williamson County is pretty rural, so obviously those rates are going to be slightly lower than like a more densely populated area. I don't know.
Yeah, I think that would be interesting. I also think that would create a lot more work
Mhm.
in time. But I think it is interesting because if you look at Williamson County compared to Travis, like that data is drastically different.
Mhm.
And so like we could definitely compare SU's data, especially to like other universities. It would just be a matter of being able to like acquire that
Mhm.
data in its like entirety, I guess.